Dr. Roth, is it going on? Right. Yes. Hello everyone. I'm Dr. Ramandeep Kaur from IPHY, and I hail from the City of Legends, New Delhi. And I've met you before as well, and the last time we discussed a lot of things, and this time I have another topic to discuss with you, and that is uh, to know the alignment of human body. And is it more important than the alignment of your own car? So let's find out, is your car alignment more important or the human alignment is more important? Okay, so let's start off with everything here. So to know more about me, I am a PPT and MPT. I did my MPT from UK, from Sheffield Hallam University, and I'm a chief physio to Physical Education Foundation of India. I'm a physio to Fit India, and I'm a national sports promotion organization physiotherapist as well. And I'm a recognized physio to Ministry of Youth and Affairs and Sports. I am also a national physiotherapist to Wheelchair Cricket Team India. And I am the director of IPHY. That is my own organization, and it is a physical and wellness therapy clinics. Right. Thank you. And again, thank you to Dr. Roth for inviting me for this session. And many congratulations to him, because he's going really well with all his sessions, and his achievements are endless now. Right? So let's start off with the alignment of body. So in a normal word, if we talk about alignment, what is alignment? So alignment is anything which is, it is the arrangement in the straight line. It could be in the sagittal plane, or it could be in the coronal plane. A sagittal plane, I hope you understand sagittal and coronal. I'm sure it's been long that you studied that, but coronal and sagittal plane, right? So the alignment of the body in sagittal plane and the coronal plane is known as the alignment of the body. So when we align the car, okay, when we're driving the car, we get to know that there is something wrong with the alignment. And the steering sometimes goes left, or it sometimes goes right, isn't it? Have you ever felt that? Have you ever felt that sometimes the tires of the car are inflated more, or maybe less, so the alignment goes bad? So you always go for your alignment checkup, and very frequently, I'm sure. But I have seen very less people, very less patients coming up for their alignment checkup. Rather, I have seen only 2 to 3% of people who actually know about the alignment of the body. Right? So, alignment for a physiotherapist is everything. So, every physiotherapist must know and must guide their patients and every individual, every human being about the alignment of their body. Right? So, how is our alignment measured? How do we know what is alignment? Okay, so we actually align the body in two sense. One is in the standing position, the static position. Static position, it could be, maybe standing or lying position, right? Or it could be sitting as well, because there is no movement. Or it could be a dynamic position. A dynamic position could be, it could be running, or it could be jumping, right? So there are two type of positions in which we can see the alignment of the body. So one is in static position, and the other one is in the dynamic positions, right? So again, in the static, if the position of the body is in a straight line, a standing position, a lying position, or a sitting position, you get to know the alignment of the body. My body alignment is this right now. Okay, so my shoulder is up. So you get to know, yes, there is something wrong, because you're a physio. Yes, you do. You get to know that the alignment of the body is changing. Right. I have a little friend with me today. That's Mr. Skeleton. Okay. So we will discuss a few things with Mr. Skeleton today. Okay. So when Mr. Skeleton was born, his alignment of the body, or the postural development, if in simple words, it was this. So the entire curve of the body, like the spinal curve, he only had the primary curves, or the thoracic spine curves and the sacrum. But later on, around 3 to 4 months, when the baby started, the baby, Mr. Skeleton, started sitting like this. When he started sitting, his curves, the secondary curves started coming up, and the cervical curves came, and then the lumbar curve came as well. Okay, so that's how our bodies. Okay, so sit properly now. Okay, we'll come back again. Okay, so Mr. Skeleton, as I told you, right? So the primary curves and the secondary curves, they are developed in the beginning. When the baby is born, the primary curves are only the thoracic spine, at the thoracic spine and on the sacrum. But later on, the whole position in the beginning, it's all flexed. It's all flexed. And later on, when the secondary curves, after about 3 months, when they are formed, the cervical and the lumbar spine curves are formed as well. Right? Okay, so how is it controlled? How is the alignment of the body controlled? This everything. This is the powerhouse of our body. Everybody knows about it, right? So the powerhouse of our body is the brain, the CNS system. So the CNS system, the central nervous system, is the powerhouse which controls all your body alignments, right? And the musculoskeletal system, every bone, every shoulder joint, every joint, every muscle, ligament, that is all associated with the alignment of the body. If anything goes here and there, maybe the contracture of one side or the alignment of the lengthening of the other side, the posture or the alignment of the body changes, right? So this is, you must have observed in the pelvic girdle. It is very common. I am going to come up to that as well. Okay. So first of all, what controls posture? So the first thing was the CNS, the central nervous system, that controls the whole of your body alignment. Yes. The equilibrium, the balance is controlled by it. The special senses, if you're not able to see, if you're not able to hear properly, or maybe sometimes if you have cold and your ears are stuck, you are not able to, balance there. It happens sometimes that you're not able to balance. So the balance goes hand in hand with the alignment. Yes, the car alignment and the car balance goes hand in hand. It actually goes that way. So your special senses should work properly as well. Because if your alignment has to be checked all over for complete package, the body package, you need to check all of your body parts for that. Okay, so a simple eardrum, if your ears, after swimming, if your ears are, sometimes we say our ears have closed up, and there is water inside, there is some kind of dizziness in your mind, some kind of vertigo that goes around. If your cervical spine has some compression, you have vertigo. So these kind of problems, they affect your alignment of the body, your equilibrium of the body, the balance of the body, and your posture. These all things lie in one straight line. Okay, so everything goes hand in hand. So the biomechanical elements that also affect your alignment. If you have any kind of say you have got a knee problem, or okay, just come out of it. If your if your shoe, if if I'm talking about girls, if your heel, if your heel breaks, you walk like this or the other way, like this, right? So that is also the alignment of the body, because your tires are not working properly, right? So that was a very, very tiny thing, but changed everything. And so you need to go from head to toe. When you observe and see physically, when you have a physical examination of the patient, you have to find out very minute things. And it actually happens sometimes. The foot curvature, or maybe the position of your footwear is ruining all your body alignments. So starting from head to toe, to toe, specifically toes, I would say, you should observe the whole curves, everything, even the shoes. Sometimes the shoe of a person, of a body, of a patient, it is in supinated position. So one side of the shoe is this way. You must have seen this. And if you don't correct it, that patient will come up with an ankle pain, or he might come up with the knee pain or hip pain as well. So you should always observe the foot or the footwear as well. Okay? Again, the sensory systems, I spoke about the muscles, and I talked about the ligaments as well. So every individual, every patient should be observed on every point, every muscle, joint, or it could be the equilibrium basis, right? So what does actually alignment do to us? Why is alignment important? Why do we need alignment? It's okay if we don't have alignment. That's okay if you walk like this, or if you walk like this, or if you're walking like this. Why is it so important? Why is it important for the car? Why is it very important for the car? Because if your car is not aligned properly, you can have an accident. It is the same for your own body. It is absolutely same for your body. So if your alignment of the body is out, if the alignment of your patient's body is out, I'm talking about your alignment, the physiotherapist alignment, and the patient alignment. If any of them is not aligned, you can have a problem. You can have pain. You can have multiple things. I'm going to list up those things as well later. Right? So your alignment is equally important as your patients, because you have to work all day. You have to see those patients. And if in case you have a stoop posture like this, a stoop posture, the patient will point out. The patient will definitely point out at you that, sir, you have a stoop posture. This actually happens. We think that these days, the patients, they are the Google doctors. They know everything. So first of all, look at ourselves, align our body posture, and then we should point out at our patients. Okay? Right. So why is alignment important? It keeps the body in the upright position against gravity. If our anti-gravity muscles don't work, where do we go? We collapse. We simply collapse. If our anti-gravity muscles don't work, we collapse. I'm repeating this. This is like very important. This is like, a death and life for you. Your anti-gravity muscles need to work. Otherwise, you won't be able to stand upright. Okay? Your movement patterns. You don't want your hip or your pelvic to go like this and this. You are not an 80-year-old woman or 60-year-old woman. You are young. Your patient is young. Or you have to keep your patient young. You need to know which side of the adductors are strong, which are contracted. So that's how it comes. That's why alignment is important. It looks very tiny, but everything changes. You give no treatment, no electrotherapy, no exercise therapy. Forget about everything. Correct the alignment, the patient goes right. And of course, to maintain, you have to give exercise therapy. But for the beginning, you need to know, कहते हैं ना पतंग. I'm sure you understand Hindi and Urdu. So कहते हैं पतंग को खींचने के लिए भी alignment चाहिए होती है. So if you just leave that, it will not be in the straight angle. एक टेंट लगाने के लिए, the tent house, right? We make शादियों में टेंट लगते हैं. So टेंट को भी align करने के लिए हम लोग वो bamboo sticks लगाते हैं. Why? Because we need to align the body of the tent. So why not to align your own body, right? Okay, so if the alignment of the body helps, it allows us to equally divide the load to all your ligaments, to your muscles, to your joints, so that there is no one pressure on one joint. Because if there is pressure on one joint, you will have pain in that joint. So we don't want that. So you should have that eye to have a look. Which muscle is affected, which joint is affected, and which is having more pressure because of the wrong alignment of the body. And the very good point is the good body alignment. It spends minimum amount of energy. So that is the best thing. Now, if we talk about the physical signs of the bad alignment, what could be the physical signs? If we talk about, the shoulders, you might have a sway, you or maybe your patient could have a sway back, a kyphotic posture, a lordotic posture, it could be that, a lower cross syndrome, rounded shoulders, a pigeon neck. It could be there. Yes, these are very tiny small things, but we always ignore. But make sure that you always align your body first. Okay, so forward head, we spoke about pigeon neck, right? Head tilt. Yes, we've seen many patients with head tilt. This could be because of your neck muscles as well. So make sure you need to check the neck muscles. Uneven shoulders, uneven hips, like this. So here, he could have an uneven hip. So if he has the uneven hip, the body will go to the other side. The feet turned inside. Look, if you have feet turned inside, inverted feet or everted feet. It could be a supinated foot, right? So you need to know the position of the foot as well. These are the physical signs. And what symptoms will it give? What symptoms? Remember I spoke to you before? That it could give any kind of pain. Along with pain, look, I'll start from the beginning. So it could give you a chronic headache. I spoke about cervical spondylitis, vertigo. You can have a back pain, a lower back pain, or a thoracic back pain. You can have neck pain, we spoke about it, knee pain, hip pain, and frequent illness. We've always seen a patient with pelvic malalignment, right? And that patient could have numbness in hands and feet because of the nerve compression. Because if there is nerve compression in the neck and the position of the body, the position of the neck is maybe towards any of the side, so the patient can have numbness and tingling sensation in the hands. Once the alignment is out, the alignment is aligned, these numbness, these symptoms go away. They simply go away. And I spoke to you about the wear and tear of the shoes. That is a very important point. Please make sure you check your patient's wear and tear of the shoes. It is very important. Okay. Okay, we come up on the laxity of the joint structures, the ligamentous structures. Maybe the fascias, the tightness of the fascias, or the musculotendinous tightness, right? It could be because of the muscle tone. Yes, the tone. It could be because of the pelvic angle. It could be anteriorly or posteriorly or hip hiking, right? Or it could be because of the joint position and the mobility of the patient. So these are the factors which actually affect the body. If the patient is working like this all day and using the phone like this all day, so the posture of the body changes, the alignment of the body changes. It could be a postural alignment change, or it could be a structural. Maybe, if the patient is doing that, the same position for years. You don't know, because, we have seen patients who've been using the phone or like this for years and years. So the position, it gets structured as well. Or maybe it could be congenital. It could be congenital as well. So watching phone or a TV is the very, very common symptom that changes the alignment of the body. Wrong sitting postures these days because of the lockdown, definitely. The posture of the body changes because I have seen, I had a patient, later I got to know he had an armrest on one side of the chair, and he was just putting all the weight on one side, and later he came up with the pelvic tilt, and we had to align it. And he has severe pain in his back, in his lower back, and the body posture had turned up like this, from shoulder to the hip and to the foot as well, as we measured it from the medial malleolus, right? So when we measured it from the medial malleolus, it was, the hip hiking was there, so we had to align the body, right? So a normal sitting posture changed all the body alignment. That's what I was saying. So one position, if you sit on one position because you're putting all your body weight on that side, or it could be this side. So the alignment of the body changed, right? Or the patient is sitting all slouched, maybe because of writing. We've got patients who've got slouch posture just because the patient was in architecture and he used to work like this all day with tiny, tiny things. So he got a slouch posture because of this occupational problem, right? Sometimes a sleeping posture may change your alignment. So you need to sleep right as well, and you need to make sure that your patient is sitting right. So if you have a prolonged posture, as I said, it could be years or it could be months as well. Because now the cases that we are getting at present are lockdown cases. So maybe 4 months, 3 more months, 5 months. So they have one position for 5 months, and they actually had that. So they've adapted that posture, that alignment of the body. Now if we don't correct it, they're going to go forever. They're going to have that pain. They're going to come up to us, right? So any kind of uneven pressure on the ligaments or on the cartilages or to the joint can lead to bad alignment, the wrong alignment of the body. Okay, so the hip alignment, the muscles that are affected, it could be because of the injury of the strained hamstrings or the iliotibial band. It could be because of that syndrome, IT band syndrome, or it could be the patellofemoral syndrome, right? So that could be the reason as well. So the strengthening of the muscles, and to relieve the pain, you need to align the body. Okay, so if we talk about a good posture, what is a good posture? The posture alignment. So in standing position, if you talk about one standing position, so the observation in sagittal plane, we could use a plumb line. If you know plumb line, right? Or you can just hang up a weight on the it could be just a thread or something. Or if it is major, you can go for a radiological help or a photography help. These days it's very common. You get to know the alignment there. Or an electromyography, right? But again, that being a physiotherapist, you are very well versed of it. So you can go with it. There is no problem. So the vertical line of the line of gravity, it passes through anterior to the angle, to the ankle and to the knees. Anterior to the knees and ankle. I'm talking about lower to upper. Okay? So lower to upper, ankle and knee. It passes the LOG, the line of gravity, the vertical line of gravity. It passes through the anterior of your ankle and your knee, and it is slightly posterior to the hip joint. Okay, so it goes a slight change of angle through the midline of the trunk, just anterior to the shoulders, just anterior, and through the external auditory meatus, right? So it goes like that. So it goes through the external auditory meatus, right? So ears, the spinal cord, the spinal column, your shoulders, the back muscles, the abdominal muscles. If you talk about the hip muscles, knee muscles, and ankle. This is the anterior side. If we talk about the posterior, so the cervical curve, you have the thoracic spine and the thoracic curve, your lumbar curve, your sacrum, your buttock muscles, your anti-gravity muscles, the vertical gravity muscles, right? They hold the good posture, the good alignment in all together. So how do we measure it? In sagittal plane and in coronal plane. And the good posture in sitting would be sitting upright, sitting all upright. Finally, stooping posture is a bad posture. Okay, so a forwarded head and a flat back, definitely I told you it's a wrong posture. And a sway back, rounded shoulders, weakened abdominal muscles. The rectus abdominis, if it's weak, it will definitely give you a bad posture. So if you talk about the joints, the atlanto-occipital joint, yes. So the opposing forces, if you talk about the muscles here, they are the rectus capitis posterior muscle. That is the major and the minor both. And semi-spinalis capitis. The cervicis, splenius capitis, the inferior oblique muscles, they all work with atlanto-occipital joint. Okay? And the line of gravity, as I told you, it passes through the anterior, right? And which movement does it give? It gives flexion. It gives flexion. If you talk about cervical, it gives extension. The line of gravity posteriorly, and the muscles that work are the anterior spleni muscles and the longest capitis muscle. That is the more important muscle here. In the thoracic, ligamentum flavum, the iliocostalis muscle in the thoracis, the spinous thoracis muscle, and the semi-spinalis thoracis muscle that work accordingly in opposing force. Okay, these are the active muscles which are opposing the force for the alignment of the body, and it gives a flexion position. Okay, and if we talk about the passive passive opposing forces. In the thoracic, the posterior longitudinal supraspinatus. If you talk about the supraspinatus and infraspinatus ligaments, those are working for the posterior lung. Right? So this is like deep anatomy that you must, I'm sure, everybody is well versed with it. Okay? So if you talk about, say, the hip joint, knee joint, so hip joint, iliopsoas muscle. If you talk about the knee joint, the hamstrings and the gastrocnemius, they are working with the hip joint, the knee joint. The ankle, soleus, and the gastrocnemius muscle. These are the active opposing forces. Okay? If we talk about in the coronal plane, okay? So coronal plane, sagittal plane, coronal plane. So the head, the eyes, ears should be level symmetrically. Okay? Make sure the head position is right of the patient. If you talk about the neck and the shoulders, the angle should be symmetrical. The clavicle should also be symmetrical. You need to make sure the shoulders are aligned. Your neck is aligned and in the upright position. If you talk about the chest, the rib cage, all the muscles should be symmetrical to each other. Right? If one is contracted and the other is lengthened, the patient could have a wrong alignment. Right? So you need to have the thoracic symmetrical of the rib muscles as well. Okay? And the rib joints definitely. So if we talk about abdomen and hip, the right, the waist angles, the angles of the waist, we call the love angles, they should be symmetrical. So you actually get to know the angle of the hip angle. It goes up or down. It is the hip hiking or hip lowering. If you talk about your pelvis, the anterior superior iliac spine should be in one level, in one symmetrical level. The knee, the patella should be symmetrical and facing straight ahead, just like this. Okay? So here, they should be straight like this. And if we talk about the ankle, the medial malleolus should be symmetrical. The feet should be parallel. It should be parallel. The toes should be very curled, not curled or overlapping, and no deviation. Okay, so there should be no deviation of the foot as well. So the foot, if you talk about only foot, here, it should not be diverted. Not everted, not inverted, not even curved. Right? Great. Have you heard of naval displacement? Has anybody heard of it? Naval displacement is the displacement or the non-alignment of your navel. This is very common. It could be in India. Definitely, we call the Ayurvedic people or the physiotherapists actually agree with this. But if we talk about the doctors, the orthopedician, or anybody, they would simply say there is nothing like navel displacement. But we have actually treated patients with navel displacement. So if the patient has navel displacement, so the navel of the body is displaced. It could be superior, inferior, or towards the lateral shifts. So the alignment of the whole body changes. Right? We call it in Hindi or Punjabi, we call nabi chad gayi. Nabi chad gayi. Okay? So the naval displacement changes all the internal organ problem as well. Okay, so this malalignment of the navel, it is because of the stomach muscles, mainly the rectus abdominis, the abdominal muscle, the rectus abdominis. It is because of the malalignment of that. Okay, and the shift of the navel, it causes sometimes causes nausea or giddiness to the patient, or there are many problems. The patient could have back pain, the lower back pain, upper back pain as well. And we've got a patient who actually had naval displacement and had always had a complaint of acidity. Right, that is very common. And because of acidity, they had joint pains. And once we aligned the navel, all the alignment of the body changed and all the organs started working properly because of the joint laxity, of the ligamental laxity of the organs as well. It happens if the navel is displaced, the ligaments of the organs also change their position, right? So that is also a very important alignment. I am not sure you all do it or not, but you must read about this if in case you go through this. Okay. Okay. So the strategies to maintain, restore your balance is to balance your ankle, your hip, your stepping. So when you're walking, you're stepping, you need to have proper alignment, and suspensory. So if you have any kind of perturbations while walking or while sitting, you need to have a proper balance so that you don't sway, you don't fall, right? So the suspensory balance of the body, the equilibrium of the body should be corrected as well. And the strategies are automatic, and it occurs between, the balance of the body, it definitely changes. But again, it has to come back, because if the equilibrium of the body is not working properly, then the body can fall and the patient can have secondary injuries because of that. Right. Okay. Just 1 second. Right. So, if we talk about proper alignment, right? Our mom always used to say, please sit straight. Sit straight. When we were like very small, it was very annoying then. But then later on, yes, we got to know that our body alignment should have been straight. And if the body alignment is not straight, the posture of the body changes. And if the posture changes, it affects all your health, all your joint problems. It gets, your shoulders are bad, you have, sitting or standing problem, right? And you need to have, the major systems of the body also work like this. So if you talk about your digestive system, if you're, say if I talk about the navel displacement, your digestive system doesn't work properly. So if I talk about your respiratory system, yes, if your rib alignment is wrong, if the muscles here are wrong, if the pectoral muscles have any kind of contractures, the respiratory is affected. So along with the musculoskeletal, or only the upper alignment, it also affects your inner organs. It also affects, the nervous system. Yes, if the equilibrium is wrong, yes, your nervous system is definitely affected. Your immune system affects definitely. If your immune system, if you have cold, your ears are not working properly because of the cold. You have you know, the cold, the ears have stopped working properly, the nose is not working properly, you can't smell properly, the immune system is not working properly, and the body is swaying that way. So you can have vertigo, right? So everything ruins. The body alignment is absolutely important. Now, how do we change? The exercising of the body. The body, to prevent the body from these kind of injuries and balance outs, you need to work on for certain exercises and to work on for certain group of muscles. When you are aligning your body, you give less stress to your joints. You give less stress on your muscles. Like you are giving less pressure to one of the tire to ruin your tire in the car. So if your one tire is ruined, you need to change that tire. But if in case the whole car tires are all fine and the alignment is all fine, you don't have to change the parts of the body. So I'm sure nobody wants to change the part of their own body. So let's just get fixed with our alignment, right? So work on your posture, work on your pelvic tilts, the abdominal muscles, they are very important. You're the deepest abdominal muscles. If you talk about the transverse abdominis muscle, that stabilizes your spine as well. So your core muscles have to be aligned. Your muscles the core muscles have to be aligned to relieve your back pain, to relieve your chronic back pain. So, and to increase all your performances in sports performance, in your daily life performance, in your sitting postures, in your standing posture, or just normal walking. So if the alignment of the body is out, this affects all your body and ruin all your daily activities. So the strengthening of the muscles and the stretching of the muscles will help you to relieve all of the chronic problems. It could be a back pain, or it could be any hip joint pain, right? So the strengthening exercises or the stretching exercises, a simple latissimus dorsi stretch or a piriformis stretch can actually align your body, right? So after stretching and strengthening of the body, you get a proper alignment, and there you go with the whole body alignment, right? Okay, you've got some questions here now. I can't see any questions coming up from your end. Dr. Roth? Can we have the question list as well, please? Dr. Roth. Dr. Saab, are you there? Can I have the questions, please? Or should I go further? Okay, let's go further then, if you have no questions. Everybody is very intelligent here. I am sure they are. Yes. So if we talk about the stepping strategy, which we use to prevent all the falls, right? It could be used in the elderly patients. So when we give certain kind of perturbation to the body, the alignment of the body changes. And the perturbation, if it is of small amplitude or large amplitude, it depends on the strategy of fall. So if the body muscles and the ligaments are all in straight position or in the aligned position, the patient will not fall, because the muscles will help that body to be in aligned position. And the base of the support, that also helps. The base of the support, if the base of the body is more like a four leg chair, is more stable than a 3-leg chair. I'm sure everybody understands what I mean. So a 4-leg base chair is balanced more. So that's how, if we have 2 legs and the muscles are working all aligned and properly, they are going to create a better base of support for your body. And if you're sitting, the base of support increases. The base of support increases. If we go on our toes, the base of support decreases. So the base of support also goes hand in hand with alignment of body, right? If we have only 3 tires in the car, right, it is less balanced. If you talk about a bicycle, it has only 2 tires. So if the person can balance on the bicycle, then only that person can ride. But in the car with 4 wheels, anybody can just sit, but not in the bicycle. Like me, I can't ride a bicycle, but yes, I can ride a car, and I can sit very easily in the car. And I drive car as well, because of the balance, the base of support, that happens to be changing in this way. So that's how, if we are in the lying position, the base of support changes as well. We are in the most comfortable position when we are lying. The Shavasana, it is the most aligned position, right? But as we stand, the alignment of the body changes, the COG of the body changes, the normal COG, which is on S2, it shifts up and down if we have any alignment problem, right? If we talk about any suspensory strategy, so the suspensory strategy, if we stoop down and maybe if we are going to pick up something from the floor, our trunk is bent. We flex our knees, we flex our hip, or we come over to the squatting position. That lowers our center of gravity. That lowers the COG of the body. And as we come up, as we stand, the COG of the body comes up on the normal position. And if we go on toes, the COG of the body goes higher. Right? So why is alignment, again, why is it important? It is important to decrease the risk of injury. We don't need injuries. Nobody is happy to have an injury. Nobody wants to sit back home. Everybody wants to go. Nobody liked the lockdown. But if you have an injury, maybe a hip fracture, you could be, locked down for 2 months, 3 months. If you have an ankle twist, a sprain, you could be booked up for 21 days minimum, right? So nobody wants to have an injury. Nobody wants to stay back home for nothing. And decreasing your productivity, definitely, right? If you're not aligned, you will fall, or you can have any kind of injury, and your productivity decreases. Because one thing, if you have a hip injury, you're not able to take that. So the productivity of the body decreases. Your efficiency of the body decreases, definitely, because again, you're not able to do efficient work. You can't even go to the washroom yourself if you're hip injured. You definitely lose all your work days. You don't have, you can't even spend quality time with your family. your turnover decreases, and of course your morale of the body, morale of your enthusiasm, your confidence, that decreases. So nobody wants that way. So I got a few questions. I'm not able to see it here again, but let me just have a look. Oh yes, I got it. Oh, I'm so sorry. I was a bit new to this. Okay, I have so many questions here. Just give me one moment, please. I will answer all the questions. Okay, so I've got a question. Ma'am, if naval displacement is there, what can we do to feel better? Okay, so naval displacement. Okay, so talk about naval displacement. So I personally use cupping therapy for naval displacement, or I can do it with a manual displacement, manual placement of the navel. The patient is lied first in supine position, and then later on in the prone position. I can show you in a video definitely, but it's I need to have a patient along with for that. But it is really easy to place it back in your position, and it will definitely help you to sort out many of your problems, right? As well as wide long duration of smoking. Noise. So the last time when we discussed about cupping therapy, right? So we could have, I can tell you again as well. You just place the cup on the navel, and let it be there for about 5 minutes. Okay, it actually does half of your work. It simply places, the muscles are in the negative pressure there, the erectus abdominis muscle. It's almost in the negative pressure, and then it comes back to the normal position. But then you have to do it at least for 2 to 3 days, so that the muscles are strengthened up. And then again, the strengthening, and you can ask the patient to have light food. And when you have to start off with this, you need to ask your patient to come empty stomach for at least 4 hours. You need to have a fasting of at least 4 hours, okay, and then come over, because sometimes the patient feel dizzy and nauseatic, and the patient could puke out. So just ask the patient to come over empty stomach for at least 4 hours, or fasting of 4 hours, if you could say, and then you can just place up a cup there, and it will definitely help you. Or you can just uh, you know place it back manually as well. But then, just to try manually, you need to be an expert for that. Just don't try it that way, because it could hurt, or it could give an ill effect to your other organs as well. Okay, right. What is the alignment to prevent knee osteoarthritis? Okay, so the knee osteoarthritis, uh, we've always seen patients with knee osteoarthritis above 50 years of age, mainly the females who have osteoarthritis, and they always walk like this. Right. So the abductors, you need to work on the abductors and the adductors of the hip. So when you align those properly, the hip alignment changes, right? And because of the one side of contracture and one side of the lengthening of the muscle, this position comes up, right? So if you align that, it will give an effect to your knee joint as well, the alignment of the knee joint as well. And if the alignment of the knee joint is, it is aligned, it will definitely give you a result on osteoarthritis. Okay, and you need to see again the foot placement, the foot. Maybe that patient is flat foot, because mainly I've seen many of the cases of osteoarthritis who have flat feet because of the weight, the heavy weight, right? So, how to align excessive lumbar lordosis? Uh, you must be knowing about, the lumbar lordosis is mainly on patients who have, a big tummy, right? So they have mainly they have the lumbar lordosis. So work on, there are specific exercises for that. So you work on which muscles are lengthened, which muscles are contracted. You need to know that is your goal. You need to see the patient, you need to find out the alignment of the body, like that. Okay, so it could be only a small part of the muscle is lordotic, right? So you need to find, that is your personal goal. Okay, how to correct flat feet? There are tons of exercises for flat feet. uh, the first main thing to correct your flat feet is you need to have an orthotics, right? So you can have a shoe inserter, which a patient can wear for a longer time, and that actually helps. Okay, so that is one. Second is, uh, you can you stand up in you stand you're standing in the standing position, right? The patient standing, and the, the I'll tell you here. So the hip position is this: hip flexion, your foot is here in this position, and then if you go outwards like this, the external rotation of the hip, and your foot is straight, so this position, this gives a very good result. This gives an excellent result. We've treated many patients with this. Okay, this is uh, a very this is actually a new technique that we have been using. Okay, ma'am, CP child alignment. CP child alignment, again, dear, you need to know which muscles are flaccid or spastic. So according to that, you need to know which part of the body has to be aligned, or it could be the whole of it. And then you have to see, you know, it is, again, you have to see the patient, and then you can't just say, okay, CP patient, and then uh, what is the alignment. It could, that patient has different postures, that patient has different alignments at different angles, so you need to see the patient first, है ना? We can do any exercise to feel better in naval problem. Harsha Das Yadav. Okay, so I've got your question, ma'am. We can do any exercise to feel better in navel problem. Exercises are actually not recommended at that time when navel displacement is there. Okay, because the displacement might change its position, right? Or simple SLR could be only done. Simple SLR. But when you when you place it back, the navel displacement, right? When you place it in the normal position, after that, say about 2 to 3 sessions, then you can give any kind of exercises because the patient is all fine. The alignment of the body is all fine. Then you can give any kind of exercises. You can give a lion stretch, or you can give Superman. Any exercise is okay with it. You can have the plank position. You can have the patient can do push-ups as well. So there is no problem for any of the exercises. But after three sessions, at least after 3 sessions. Any more questions? Any more questions? Okay, ma'am, can we do stretching exercise to maintain? Yes, definitely. Stretching and strengthening are the only exercises uh, which helps to align your body. Okay, so strengthening and stretching. So strengthening could be starting with a half kg weight and then going up to 1 kg, 2 kg weight, and stretching definitely any muscle, any type. Okay, it can help. It actually, these are only the ones help. Alignment of wrist drop. So alignment of wrist drop, first of all, wrist drop, right? So if the wrist is dropped because of the radial nerve palsy, you give what? Okay, tell me uh, which splint do we give? Which splint do we give? The cock-up splint, right? So wrist drop, we give a cock-up splint. So first thing you need to give to the patient a cock-up splint. It could be a professional cock-up splint, or you can just make it yourself. It depends again on the patient. If your patient can take up, because cock-up splint in India, it causes about 2,500 to 3,000 rupees. But if your patient can afford, if your patient can't afford, then you can just make it with a simple cardboard as well for the patient, right? So first, if the orthotics are of need, definitely give orthotics to your patient. Okay, then only the wrist drop, the alignment, we can't, there is no alignment uh, just like that, because if the patient is already having a wrist drop, first you need to align that position, you need to get it back, okay? And then if it is just a normal wrist drop, maybe or just postural one, right? So strengthening exercise, and if the strengthening exercises work very well for the wrist drop, then you don't need anything, you don't need any orthotics. Okay, then first stretching, then strengthening exercises, give it with the weight exercises, and then it will help you, right? And then then there is no disalignment, right? Please, how many days to take to improve naval displacement and which food is avoided? Harsha, for naval displacement, you usually give light food. It could be semi-solid food, like if you if you know about khichdi or dalia, right? A porridge, you can give that food to your patient, and at least 3 days. Okay, so 3 days of the treatment and then naval displacement is all okay. Which exercise is more for naval problem? You know the question. I already told you this. If you have a patient with naval displacement, try not to give any exercise to that patient for 3 days at least. When you think the patient's navel has been aligned, then you can start with SLRs and then any exercise. Then there is no problem. You know the patient will tell you himself that he is feeling much better after the alignment of the navel. Okay, and then you can do anything, then there is no problem. And again, you know, I am saying 3 days because I have treated I usually treat my patient in 3 days, but again it depends how are you doing it, how is your hand, right? So it could take 3-4 days, it could you know, it could take 2 days as well. So again it depends about your hand, your goals, right? At my end, my patient usually is cured in 3 days for naval displacement. There is no problem. And what can we do for pain? Pain again, it depends now. So if the patient has pain, you know, I always give a combination of treatment. I give for pain, I can give homeopathic medicine as well, because I know that it's not going to affect any of the patient's body organs or anywhere. Or sometimes I give Ayurvedic medicines. So you know, physiotherapy for me is a combination of treatment, because my aim and my goal is to treat the patient anyhow. Okay, I honestly, I don't only apply one technique. I always apply different techniques, because I need to know, my main aim is to treat the patient fully. Okay, so I don't say that okay, allopathic is good or Ayurvedic is good, but I always give a combination of treatment. Okay, one again, I can give you one tip for a naval displacement patient, because the patient is always saying, and they always say that we have acidity, right? So I can give you one, if you want to write down. We get, you know, I don't know, you get it in your country or not, but in India, we get sat. You know, if you've heard of pudina, you know, mint sat. Sat means the the rock form of the pudina, the mint leaves, the rock formation. So you take about 8 grams, very little, about 8 grams of sat of pudina, 8 grams of sat, the rock form of uh, ajwain. You know what ajwain is? The cardamom, छोटी छोटी सी होती है अजवाइन, है ना? So that, and uh, again sat of, wait, I'll tell you. Just give me one little moment. So we have sat of ajwain, sat of desi kapoor. If you heard of kapoor, okay. So these three sat, they are they come in rock form, the white rocks. Okay, just like salt. So if you, when you get it from your from the shop, you always keep it separate. You never mix it, because when you mix it, the chemical reaction, it makes it a liquid. So when it is a liquid, then it is of no use to you at that time, because you actually have to mix it in a glass bottle. Okay, so you put all these three mixtures in a glass bottle, and then take it for you can take 3 to 4 times a day. This is actually simply Ayurvedic treatment for acidity, and it will be actually an excellent treatment. It has helped multiple, I mean, number of patients, right? So for the naval displacement, yes, this is actually very, very nice. You can actually give that to your patient. So one more question is there from Maimuna Javed. Sorry if I'm taking your name wrong. Uh, Please explain alignment of anterior and posterior. You know, dear, you need to align. First of all, you need to know the anterior and the posterior tilt. Once you know which one is the anterior and which one is the posterior tilt, you have to go opposite. Simple, very simple. Okay. So first thing is you need to observe the physical examination of the patient. If you know your patient has a posterior tilt, then you have to go anteriorly. Okay. And if you know the patient has anterior tilt, you need to go posteriorly. Simple. It's very simple. Right. I think there have been a lot of questions. If you have more questions, you can come up with me on my page as well. Okay. And you can ask me personally. I have, it is open for everybody. Right. So now I think I would end up with the session. I have another session in just 15 minutes. So I need to just, brush up with that as well. Okay. Thank you for your session today. And thank you so much, Dr. Roth, and everybody, all the students, all the physiotherapists for giving me your precious time. And if we get chance, we can do the sessions again as well. Okay. And thank you. Please send me the feedback. Okay. And if you need more, more lectures, or if you need more information about any of the things, if you have any kind of questions, you can come up to me anytime. I am really open for everybody. Thank you. Thank you so much. And bye bye.